Congresswoman Tammy Baldwin is a fifth-term Congresswoman. Wow. Representing the 2nd Congressional District of Wisconsin. She is a leading advocate for universal health care, protecting Social Security and Medicare, and increasing support for public education, including financial aid for higher education. Welcome, Tammy.
Thank you, Mr. Chairman, and thank you, Ranking Member Klein. I very much appreciate the opportunity to testify before the committee today. I think members of this subcommittee are undoubtedly aware that over 46 million Americans are uninsured. Millions more are underinsured. In fact, the Commonwealth Fund recently released a study estimating that there are 16 million Americans who are underinsured, meaning that their insurance did not adequately protect them against catastrophic health care expenses. So in aggregate, we have 62 million Americans with either no health insurance, sporadic coverage, or insurance coverage that leaves them exposed to high health care costs. 62 million is about 20% of our nation's population, 1 in 5. Meanwhile, as was noted in the chairman's opening statement, Congress has taken no significant steps to provide health care to these uninsured and underinsured Americans, and this lack of progress is not for want of ideas. We all know that various proposals have been floating around in Congress for years, even decades. Believe it or not, we have been talking about this issue at the federal level for more than 60 years. The first bill calling for national health care was introduced in the House by Representative John Dingell Sr. in 1943. And as a tribute to his father, his son, John Dingell Jr., has been introducing that same bill as H.R. 15 every session since. In every session, we have a number of bills purporting to increase access or to create a national health care system. About 24 bills to expand health care coverage have already been introduced in this 110th congressional session. 62 bills were introduced in the 109th Congress, and most were intensely partisan. So clearly, on the issue of health care for all, we're not at a loss for words or ideas, but we still haven't figured out how to get the job done. But where we are seeing the job get done is at the state level. Innovative proposals in states such as Massachusetts, Vermont, Maine, Oregon, and California, and my home state of Wisconsin demonstrate a clear desire on the part of states to reach an agreement and move forward. Yet, when one studies these proposals, it's clear that the states are constrained by federal laws and regulations. There's a reason why we see state proposals that are often very similar, and that's because states are all operating under the same set of constraints that we've imposed upon them, under ERISA, under our tax laws, and under a plethora of health care laws and regulations. Recognizing this and feeling that we could not afford additional years or decades of inaction at the federal level, I convened my colleagues, Dr. Price, Mr. Tierney, and last session our former colleague, Bob Beaupre of Colorado, in crafting H.R. 506, the Health Partnership Through Creative Federalism Act. And our bill is noteworthy, I think, for a number of reasons. First of all, as a commentator in a medical journal just mentioned, it is both an ends and a means. In other words, it addresses both the substantive problem that we confront in this nation, but also the political obstacles that we face in moving forward on health care reform. It is also bold. You couldn't describe this as an incremental approach. And a recent analysis of rival health care reform plans pending in Congress right now indicates that about 20 million additional Americans would be covered if only 15 states put forward applications to participate in this creative federalism concept. It is also bipartisan. Right now it enjoys 66 co-sponsors after just a few months after introduction, 36 Democrats and 30 Republicans. These are people who disagree intensely on how to get the job done, but have come together around this bill so that we can test our rival ideas in the states. It is also a budget-friendly bill because of its budget neutrality provisions. It allows the federal government to be a helpful partner to states which are already taking the lead in making reforms. The federal government should be helping the states as they try new approaches, not hindering them. But this bill, as I mentioned, does not simply throw money at the problem. We're looking for systemic change and encouraging bold innovation. Our bill authorizes grants to individual states or groups or portions of states to enact the strategy best suited for them. And under our plan, states will have a lot of freedom to think creatively and independently. I note my time is over, so I will hope that you read the rest of my pre-printed comments.